Welcome back to the Factor Uncensored. COVID-19 has no doubt infiltrated every part of our lives. For pregnant women, it has affected the decision to nurse their children. Some vaccinated women feel pressured to breastfeed in hopes it will protect their child from the virus. Our expert explains the benefits of nursing during the pandemic.
And joining us now here on the Factor Uncensored is Dr. Melanie Mozoon from Kelsey-Seybold to talk about this issue that parents have a decision to make during the pandemic. You know, if you've just had a child and you're breastfeeding, there are concerns out there. You know, will you help the child? Will you hurt the child? If you're vaccinated, will you pass on antibodies through breastfeeding? So what's your best advice, Dr. Mozoon, for those parents who are struggling with that decision?
My advice is to go ahead and breastfeed and to take the vaccine, and the vaccine will help protect your baby. We know that the vaccine induces good antibodies in mothers, and those antibodies are of two different kinds. One is IgG, which stays in her bloodstream and can pass to a baby in the womb if she's pregnant. And the other is IgA, which is called a secretory IgA or secretory antibody. It's in your saliva, it's in your respiratory secretions and your respiratory tract. And that protects the baby also through breast milk and coats the baby's respiratory tract and gastrointestinal tract. So that those antibodies that mother made from getting the vaccine or from having had a case of COVID do transfer to the baby.
Now, what if the mother hasn't had COVID in the past or vaccinated? What are the risks of that? Go ahead.
Yeah, so her baby will not be protected, and so her baby is at risk. We know that most of the time when babies or young children get infected, they don't have a serious infection, but occasionally they do have a serious infection, or they have that multi-system inflammatory process that makes them seriously ill. So it is important to consider protecting your baby any way possible, and vaccination is the best way through the mother, of course.
And what if the mother is pregnant, fully aware, or she may not be aware she's pregnant, and she decides to get the vaccine? Should she have any concerns getting the vaccine while pregnant?
You hear people say that the vaccine wasn't tested in pregnancy, but in fact, millions of people have gotten this vaccine, and of those millions, many have been pregnant, including young healthcare workers who were vaccinated because they were at very high risk of getting infected. And those healthcare workers volunteered to be followed to see if there were any ill effects on the baby or during breastfeeding, and none have been found. The only occasional problem with breastfeeding is that occasionally the stress of the vaccine, you know, it makes you slightly ill, may reduce the mother's breast milk supply for a few days, but the supply generally comes right back as she recovers from the side effects of the vaccination.
For those who may be just afraid to have a child now during the pandemic, what would you tell those people out there?
You know, there are difficulties at every time, you know, of our life. And so this is a very difficult period. Fear is part of the reason people may choose not to have a baby, and so are finances. It's a hard time to try and keep your finances of your family strong. But you know, there's no specific reason not to have a baby at this time. We can protect the baby through immunizing mom and through mom continuing to breastfeed. And we can all mask and get our own vaccines to try and protect the whole population. So I'd say, you know, you have to consider your finances. You have to consider whether you're willing to get vaccinated if you're thinking about having a child. But I would say that many people are having children anyway. They're home together, and family is important.
Absolutely, absolutely. Now, for those vaccines for parents out there who are concerned about getting their children, or parents who want their children vaccinated, what are the age groups now that we're looking at potentially in the future, and the ones that are available now, Dr. Mozoon?
Of course, right now, it's available for children 12 and up. And what we're looking at is for the 5 through 11-year-olds, there's already a request by Pfizer to have the vaccine approved for that population. So we should expect in the next month or so that vaccinations may well be authorized under an emergency use authorization for that population, 5 to 11. And we're also, there are studies ongoing for children as young as 6 months. We know that that vaccine causes some fever and illness, and in general, when we're unsure about how much illness a vaccine might cause, we don't give it to children younger than 6 months. But there are studies of children ongoing, and I expect that by December, we may well be talking about vaccinating the entire population 6 months and up, much as we do for influenza.